Good morning, everyone.
Good morning.
Good morning. Good morning. My name is Kyla Walters Clinton. I'd love to welcome you to the Medicaid Renewal Advocate Forum. Thank you all for your attendance throughout this entire journey. We could not have done this without you. Next slide, please. Today, you're going to hear a little bit more about operations and data, our impact summary, the transition plan and what's next, update communications and resources, and then we'll end with a thank you. I'm going to turn it over to my colleague and friend, Chris Bresco, for the operations and data update.
Thanks, Colin. Good morning, everyone. On this first slide, nothing new that you haven't seen before. Of note for this is we have actually mailed out the renewal notices for the first group of the second year of renewals, what we're calling, tranche 2, cohort 2, however you want to say it. The first group has gone out with their renewal date being the 31st of May, excuse me. So we've gone through, and I'll catch us on the next slide, we've gone through the entire Medicaid population for renewals at this point. We will have a roll-up of the year's data. We don't have it yet. The data team is working on that now. But continue to look and watch the Stay Covered RI website, the data dashboard, and that information will become available or will be presented in a forum to be determined at a later date. But look for that to come forward. We're actually doing very well in that respect. Next slide, please. So as you see, this is a roll-up by zip code of our Medicaid beneficiaries. I just put this on here to show, this is as of February, but if you look down at the bottom of the square box on the left side, total Medicaid enrollment, that is down from a little over 370,000 at the beginning of the return to normal operations effort. So we have enrolled new people, we've terminated some people, and some people have moved over to the quality health plans over at HSRI. But our whole goal the entire time and what we've maintained as our mission was to maintain benefits for all of the people that are qualified for them. And I think we've done that fairly well. Next slide, please. A slide you've also seen quite a bit. This is the latest updated on the Stay Covered RI website, and all these slides are available there. You see the last cohort that went through, the last group was the March group. They were closed, their eligibility date was the March 31st, I keep doing that. And then you see where we've added on the first group of the second year, the second cohort. Of note, if you look, we still maintain a passive renewal rate of over 50%, which is one of the tops in the country. So that is still positive data as we move forward. And in the future slide, they're going to talk about waivers that we have from CMS that allow us to maintain that really high passive renewal rate. Next slide, please. Just some data on the children as we go through. Remember, we started our first renewals with families with children and children was December mailing with a January 31st renewal date. As you can see, the renewals, the number of passive renewals are even higher with our children population than they were with our overall MAGI population as we do the renewals. And the number of procedural terminations or those ineligible is much, much lower in the families with children. Just a note for you. Again, this slide is available on the Stay Covered RI website. Slide, please. And you've seen this before, and I just wanted to reiterate it one more time so that when you talk to your clients and the beneficiaries, new for the second year renewals for what we're called cohort 2 is the passive renewal process. Those that are going to be passively renewed will not receive a renewal notice. They will just receive their benefit decision notice. So not receiving a renewal notice and being passively renewed is the good part. We're still well over 50%. Just ensure people aren't becoming don't get excited by not receiving a renewal notice. It just probably means that if they've not received a renewal notice and their contact information is up to date, that just means they've been passively renewed. And they will receive that benefit decision notice that'll attest to that fact. Next slide. And that concludes my portion of the briefing. I'll be on till the end to answer any questions that may pop up. I'm sorry, Nicholas, see your hand up.
Hi, Chris. Thanks. I have two questions for you. The first one, when you were on the slide that said that approximately 30,000 beneficiaries rolled off, do you have any data that says what category of services that they might have been utilizing, such as whether they were long-term services and supports, Katie Beckett program, probably not as roll off, but adults with disabilities, general adults with no health conditions. Do we have that information?
We haven't tracked that level of specificity, Nicholas. What I can tell you is with spot checks that we have done, it's predominantly Magi Medical. It is not the endangered populations. That has been much lower, if at all.
Okay. And then the second question that I have, for the ones that have been passively enrolled in the CHIP program, has there been any special attention to those that might have been aging out of children's services but may still need those services as adults, such as the turning 21 population?
Yeah, we have addressed that population as well, ensuring that they understand that as they age out, they just need to apply for reapply for benefits and go through that process as well. But those have been taken care of as well.
Thank you for answering my questions. Appreciate it.
You're welcome, sir. Have a great day.
Thank you for the questions. Now we'll turn it over to our Chief Public Relations Officer, Stephanie Menders.
Thanks, Kyla. I'm going to walk through a couple of slides here that we hope will exemplify some of the reach that we've had from a communications and outreach perspective over the course of the past year. So we've got some numbers here. I'll quickly walk through them. The first to the left of your screen are some analytics from our staycovered.ri.gov site. I hope that that's a URL that everyone's heard plenty of times now and will continue to remember. We'll keep that resource up to date post unwinding. You can see we've had about 182,000 views on that site and 576,000 events. That includes link clicks and document downloads. So thank you to a lot of the people on the call that contributed to that number. We've appreciated you visiting the site and using the resources there. Next, the Healthy Road mobile app. Over the course of unwinding, there's been 17,000 documents uploaded through the app and 92,000 push notifications sent. Next, for the Medicaid Renewal Lookup Portal, we've had a total number of queries of 14,500, and we've seen 6.3K unique users. What that tells us is that of those 6.3K users, many of them are using the portal more than once. That's something that we have encouraged people to do, to check back frequently in case their renewal date has changed. So we're glad to see that people are revisiting that resource repeatedly. Our Medicaid renewal ad campaigns, we ran that over 2 phases. One last summer to the general Medicaid population, and one in the fall and winter targeted to our households with kids on Medicaid as they approached their renewal date. And we saw 12.2 million impressions there scattered across those 2 ad campaigns. And those campaigns were also in English, Spanish, Portuguese, and some Cape Verdean Creole. They included radio ads, streaming ads on YouTube, Instagram, Facebook, as well as some print ads in local newspapers as well. 3 locations for DHS document scanning centers opened during the unwinding period, and about 130,000 documents were uploaded there. We continue to see great use of those resources. It's a place where folks can quickly go and scan their documents into their cases. And we see very quick in and out there, 5-10 minutes for people to go in and do what they need to do and get out. Kyla's going to speak a little bit more in a little bit about the Medicaid renewal mini grants, but we've seen 32 organizations participate in that program. There's been more than $288,000 distributed over the 3 cycles. And We just wanted to quickly note the partner and provider engagement that we've had as well. Partially here, we've seen 174 forum registrants. Obviously, we don't have 170 people on this call today, but we're glad to say that we also share those materials over email with those folks as well, and see good communication returning as well from folks who aren't able to attend live, but receive the follow-up materials. And lastly here, we have also been sending out monthly updates to Medicaid provider networks, and those have been going out to about 3,400 providers every month. And I'd also like to recognize the engagement efforts of our managed care organizations, including Neighborhood Health, Tufts, and United. They did an amazing job with their outreach and support network. You can see here they did direct mail, direct email, outbound phone calls to ensure that folks who were approaching their renewal date knew the resources that were available to them. They also did some texting campaigns. They provided direct support to members. They held in-person events and offered real-time online support as well. And you'll see a note here at the bottom that all three MCOs worked with DHS and the City of Central Falls to hold renewal events. There were 3 events earlier this year really focused on households with kids, where a total of 27 appointments were made, and those included multi-member families receiving support with their renewal. And I'll turn it over to Kyla for some conversation about our mini grant program.
Thanks, Stephanie. I really want to thank all of our community champions. Your voices are the voices that the community listens to, they trust. And so it's very important for us to have you at the table and continue to strengthen that partnership, because your outreach made this possible. And you've always been able to pick up that member support engagement, and we just want to take the time to thank you. So here are some of the organizations that applied for the mini grant, but there are so many organizations that have supported this work that are not seen in this mini grant application process. So we want to thank those partners as well. Some of those partners are like United Way. They're always a support with their 211 system. And there's many, many more. So if you're not on this list, don't think that we're not thinking about you and thanking you and continuing to have you in our circle of support, because you are that circle of support, and we thank you. I want to talk a little bit about one of the ways that we're going to thank our mini grant partners and sustain this relationship. In the next cycle, what we're going to do is invite mini grant people that have applied for mini grants and see if they will, or if they're interested in dedicating a web page that mimics all the voices or the messages that they've been sharing with the community, and provides links back to Stay Covered RI so that we can keep this resource in the community. So if you have applied for a mini grant in the past, we stay tuned for an invite to see if you're interested in creating that continued pathway of communication. Next slide. What you'll see is the support that we've provided in the city. As a result of the mini grants, we were able to ascertain who's providing what services and in what zip codes do they reside. When I become a little bit more tech savvy, I hope to produce a map so that we can not only see the partners that applied for the mini grant, but the partners that are out there and providing services, and be able to break that down for you. What you see is some of the top zip codes that have the highest number of members. And we saw that earlier on slide, I think it was like slide 2, if you want more detailed information. Next slide. And this is a little bit more about sustaining that impact. I shared a little bit about that earlier. This will be the 4th cycle of the mini grants, and we want to utilize that as a thank you. We've made it through this whole entire year with your support, so we'd like to continue that and sustain that engagement and that message. So we'll be inviting our community partners to participate in constructing a website or web page dedicated to Stay Covered RI information. So look forward to that, and thank you again for being such dedicated partners. We're going to go to the next slide. And the next slide talks a little bit about Health Service RI's impact. They were such amazing partners. They had a street team that took flyers out in English and Spanish and dropped them off to different communities. During open enrollment, which would be around November of last year to January, the street team took materials to 348 locations. And I see that we have our HSRI representative, Yvonne. So I'd love to turn it over to her to talk a little bit more about the impact that that office made.
Awesome. Thank you so much, Kyla. Yeah, I was just going to say, it looked like you were already kind of getting into things, so I appreciate that. But yeah, so our street team with HealthSource RI basically consists of individuals who go throughout the state, dropping off different materials. So we have our general flyers, but we've also been also dropping off Medicaid flyers at different locations, ranging from libraries to community centers and organizations to bodegas and local shops and whatnot. And so that was kind of one of the larger outward facing sorts of forms of outreach that our team has done. And then on the communication side, we have done highly segmented email communications throughout the course of this process. And so we've been segmenting our different groups basically based on how to best provide the information that different folks need. So ranging from our new and potential HealthSource RI enrollees. So we grouped individuals into different categories that were based on their enrollment status, their premium assistance, eligibility, and other eligibilities. So we had a variety of different groups, which I won't get into all of them, but for example, we had a specific email segment that was individuals who, for that particular month that they were going to be terminated, they would be getting, if they were eligible, those who would be auto-enrolled into our program with that premium assistance. So we would send them an email that's just basically saying, you know, has your coverage changed? You're eligible to, you've been automatically enrolled into this particular program. You have 60 days to change that plan or cancel it. So making sure that we're still giving people clear access to choose to change the plan or disenroll if they do not want that coverage. Another group that we did was individuals who were not necessarily auto-enrolled, but who were eligible for that premium assistance. So also informing them that if they were to enroll in a plan through HealthSource RI, they could get those 2 months of premium assistance through us. And then there were several other groups, such as those who were ineligible for premium assistance, but would still be eligible to select a plan on the exchange. And so based on the respective groups that would be receiving whatever type of message we sent, we basically kind of made sure that they would get the sort of kind of proper messaging related to what they're eligible for, related to what options might be available in terms of financial assistance to them. We sent out over 50 emails, pretty much from the start of this process to now and moving forward. We're still continuing to outreach to folks. We send about 4 to 5 emails each month, again, to several of those groups. And we sent emails to nearly 57,000 recipients. Of course, this number does include duplicates because some people might have fallen into multiple groups, such as those who we might have initially emailed about their auto enrollment and premium assistance, and then we would later email them 2 months later saying that your premium assistance will be ending soon, and if you want to continue your coverage, you'll need to provide a payment for that following month. And so we also did a little bit of text message outreach follow-ups to certain groups. So again, those who were either initially auto-enrolled or individuals whose premium assistance would be ending. However, our text messaging outreach was not quite as robust as the emailing due to some hiccups that we had along the way. So that was kind of our bigger focus. We also added the loss of Medicaid as a qualifying life event to our special enrollment period. So we included that on our print materials, in our advertising messaging, during our virtual information sessions as well. And we also coordinated very closely with EOHHS and DHS to deliver Medicaid palm cards to public elementary schools in Providence, Pawtucket, Central Falls, and East Providence. And then lastly, we had sent Medicaid renewal cards that were included in 72 packets to Rhode Island libraries. And those were those packets were distributed through the Office of Library and Information Services. And it looks like we have a question. Yes.
Hi, Jody DiBernardo from Neighborhood Health Planner, Rhode Island. Hi. Do you have data by any chance on the individuals that went into the commercial line of business or into the exchange and their 2 months of premiums were paid? Are they staying or does anyone have data on that? Are
That
they
is-
staying after
Mhm.
those premiums are paid, or are they terming?
That's an excellent question. I do not have that data at the moment. However, I'm sure we do have access to that and can certainly provide that. So I can follow up with my team after, and if that's all right, we can send that information along to Stephanie and Kyla, who
That's
I would
great.
presume would share that information with the rest of the groups here, the folks here.
Thank you.
Awesome.
Yes,
Yeah.
perfect.
Thank you. And if you could just write that in the chat as well, that would be great. Just
Okay.
so that way I can take that exact question and send it along to our data team so we can get that as well. Thank you.
Thank you.
Yeah, I see
And-
someone else in the chat as well said they are interested in that similar information. So Yvonne, we can include that in our follow-up package to attendees.
Wonderful. Thank you so much. And again, thank you for letting me speak a little bit about what our team has been doing.
Thank you for that report. And now we're going to hear a little bit more about the transition plan and what's next. And I believe that I'd be turning it back over to Stephanie.
Sure, I'll speak a little bit about some of the post-unwinding work that we're taking on. Many of the strategies that we implemented to make renewals easier over the course of the unwinding, we're happy to report will remain. CMS has automatically extended all of our waivers until the end of the year, and that includes the waiver that allows us to bypass the resource test for non-Magi members during renewals. Self-service options like the lookup portal, the Healthy Road mobile app, the scanning centers, those will all remain as well. The reminder and thank you notices and text messages that we implemented during the unwinding period, those will remain. That basically means that if someone is approaching their renewal deadline and we haven't heard from them, we'll send them a notice and a text message reminding them that they have to send us some information for us to determine their continued eligibility. And then we'll also be sending a thank you message letting them know that we've received their information and that we will get back to them with the BDN. Yep. We're also going to be implementing something new over the course of the next few months, an email and a text message to go to any members prior to their first renewal. As we know, there's no special enrollment period for Medicaid. New people are coming on all the time, and we want to make sure that they're getting connected to information and resources just the same as folks who are going through the renewal during the unwinding period. So we'll be sending that information out to members a couple months before their renewal date, just to make sure that they have access to those resources. Our mobile navigator program will also remain. Right now, it's scheduled to continue until June 30th. So we're hoping to get into some Pride events, some upcoming spring events. So just a reminder that you can request a navigator to attend an event in your community and support with any questions about health coverage through Medicaid or Health Source Rhode Island. And as I mentioned earlier, staycovered.ri.gov will continue to be maintained and will include educational materials in 12 languages, and the data dashboard will continue to be updated there as well. And here I'm just going to walk through a couple of the updated resources that we have posted on staycovered.ri.gov. You all have been amazing partners in getting our information and our literature out there. Right now, we've got some evergreen resources posted on the website. So hopefully these will continue to be accurate and up to date for the longer term. Right now, they're only available in English. We are getting them translated into additional languages, as mentioned. We have an info sheet, a rack card, a poster pack, and we also have a digital communications toolkit where you can find some newsletter blurbs and social media content, including photos and captions for your consideration to share with your network.
Thank you, Stephanie. Is there anything else that you'd like to say before?
Yeah, I'm trying to change the slide and it seems stuck. Let me give it a second here. Do you want to talk, Kyla, about the continued engagement options, or do you want me to run through this as well?
Sure, I'd love to. So here is a little bit more about the continued engagements with EOHHS and Medicaid. There's a Consumer Advisory Council led by one of our esteemed partners, Lisa DeMoro. She's on the call today. It's been a great support. And she's supported by Caitlin Robb, who's also on the call and has been an amazing support throughout the last couple of months. In that session, you'll get monthly updates on Medicaid programs, call centers, and opportunities for open discussion. That takes place every other month, I should say. Please follow us on social media, HealthSource RI, Department of Human Services, and that EOHHS Stay Covered RI website. Utilize the Stay Covered RI website for any more information and resources. Request a mobile navigator. You can find that on that website as well to attend your upcoming events and provide processing and resources for Medicaid applications. Participate in upcoming focus groups. We have loved having the support of this community and the voices. It really impacts the direction of some of our materials. So continue to participate in that way. And add us to your agency newsletter. If you can dedicate a section that continues to share this message, we really appreciate it, because we want to make sure that people stay abreast of Medicaid renewals and it becomes an easy process. And when there are bumps, we get you guys we get the members to the places that they need to be. Now we're going to take some time to open the call up for discussion. We'd like to bring your voices into the space. So are there any questions? Since I hear no questions, are there any stories that people would like to share, reflecting over the last 12 months? Are there any positive or negative stories that you'd like us to think about and consider? What went well? What could have been done better? Maybe some of the most common questions you might have heard in the field.
Kyla, we got a couple of people with their hands up.
Oh, I'm sorry, I couldn't see anyone.
Marjorie
Thank
was
you.
first.
Good morning. I think I've voiced this before, and with no exaggeration, I was very concerned that this would go sideways in a really bad way. And that didn't happen. And I think it didn't happen, number one, because EOHHS and others listened to the people who talked to the community, listened to all these members who are out there interacting every day, and really adjusted, what they were doing and how they were doing it on the basis of that feedback. And I just found that was probably one of the greatest things about being involved in this, is really getting your ear, from Lisa to Stephanie. Everybody really listened and was quite honest about what they could do and what they couldn't do. My only comment, and that's coming up, is the BDN notices. I can't wait to start working on them. One of the things that's difficult, and I understand, is sending out notices that are meaningful to the people who are reading them, while dotting the I's and crossing the T's that are necessary from a legal standpoint. But I think we can find a happy medium. We didn't hear a lot from folks. It went rather smoothly. Even people who didn't get the notice right away or didn't open it, they had the time. And that's what another thing we gave people, is time to react to these notices. So they may have sat on people's desks for a week or two, but they got to it. They got, renewed. So overall, I think it was very successful. And like I said, I was a doubting Thomas. I'll admit that right up front, but it went very well from my perspective. Thank you.
Thank you, Marjorie. I think I'm sure others have stuff to say from OHHS too, but we really appreciate that feedback. And I really credit I have to say, the other folks from EOHHS on the line, especially the communications team, because I think this to me was a model in terms of how, if we, you know, hopefully we won't have anything like this again, a post PHE kind of thing. But when we have, you know, success, when we have things that we know are going to be difficult to roll out, even as you said, even just working on the BDNs together, I think I'm hoping we started, you know, this will be part of our process going forward because it has been very successful and really, really collaborative and collegial. I really feel like it's been a model for us. So thank you all for doing that as well.
Thanks, Lisa. Fanita?
Yep. So I think it rather went well. I think what worked well was just working with EOHHS. I know I personally do a lot of community events and outreach over the past year, and so when I heard about redetermination happening and return to now, it was just trying to get the word out to community members. And there were some that were very hesitant because I work with a lot of minority community, BIPOC community, right? So they were hesitant to not fully understand what was happening because they didn't have to renew for so many years. But, you know, there were some that had lapsed, like they didn't pay attention or they thought it was fraud. So that sort of like one-on-one and sort of explaining to them that, no, this isn't fraud. This is not fraudulent. You know, like this is real. This is happening. And you want to make sure that you're assisting them in the best way, that trust. Everywhere I've gone, I've always brought your materials. So Stephanie has been wonderful. Like every material you have, even HSRI materials, I bring them with me when I do my outreach event, even now. And that's why it's so key when I asked about the 12 languages, because they're not everyone's going to understand English and Spanish, right? So I really love that you're looking outside the box and thinking about other communities that we serve, and being really cognizant of that, because there are folks that we are missing because they don't understand. And so that one-on-one, when I do the outreach, I'm talking to everyone, even English speaking, you know, I have missed some. And so you're walking them through the process, trying to be proactive in preventing, but also, you know, assisting them if there is some sort of lapse. So I really appreciate and applaud the work that you've done. Thank you for the partnership and collaboration and all the materials. I think they were wonderful. I continue to use them myself. Every time I go out, I have those materials with me. And I look forward to seeing what's going to happen after this. So thank you very much.
Thank you, Fanita. I see we have a couple of comments in the chat. Heidi Ross, if you would like to come to bring your voice to the space, feel free. Otherwise, I can read what you wrote. And she says that the stacks of envelopes that people receive can be overwhelming and that they often remain unopened. Anything we can do to streamline that process is welcomed. Denise writes in and says, overall success here. Not a story, just a comment. A lot of patients were automatically being renewed from United Health to NHP. And she wanted to give some insight on how many of our United Healthcare members are now NHP, and some of them didn't select that change. So we may be able to do some talking with our partners and find out a little bit more about that and follow up. I don't have that information at this point right now, but I see you and I hear your question. Someone else writes, we see the same thing on the other side, NHP moving to another MCO without their knowledge. So we'll see what we can do about getting and having a discussion about that. Yes.
Sorry. I think, I think that the issue with people moving to plans, when they had no knowledge of it and didn't request it, that was, we identified, I think we talked about this at some meeting, but we identified that there was a system issue that was flipping people. I'm not sure why or how it happened, but it should be fixed. So if you're experiencing, or your consumers, the consumers you're working with are experiencing that, please send me an email directly, because that should no longer be happening. The only way people should be changing plans is if they request to do so, or if they don't choose a plan initially, and we send them a letter. If they still don't choose, then we auto assign them. But if they're in Tufts and all of a sudden they get a letter that now you're in United, that's a problem. If that is not something they know, and again, that should have been corrected. So if it hasn't been, like new cases now happening, please let me know. Marjorie, did you have a question? Was your hand up for that, or?
Yes, basically, I guess what I'm asking is, when a person I hear that from someone, what is the best advice to give them to rectify it? So if they have been flipped to
Yeah.
NHP to United, or vice versa, what do we tell them to do?
So my feeling, and Yvonne's on, so I think what we're telling people is to call HSRI. Yvonne, is that correct? Is anyone else on who can, because the HSRI will be able to take that information down, and if they can fix it, they will. If not, they'll send it to us. I mean, you can send something to me directly if you'd like, or people on this call, but consumers themselves, I think, should be calling HSRI saying, I was in neighborhood, I just got switched to Tufts or vice versa, and it wasn't to my knowledge. The HSRI call reps should know that they can do what they can do, and then they also should be letting OHHS know that this happened. And Yvonne, is that correct from your perspective as well?
I do not have, exact confirmation on that. I
Okay.
would think so,
Yeah.
because we have had a person or two who's reached out like via social media about that. So yeah, we do have like a tier 2 kind of like escalation team who ideally could and should be able to handle that.
Right.
But I will also see if I can get confirmation
Yeah,
on like,
I'm pretty, thank you. I'm pretty sure I have to remember if it was Kathy Mazza or whomever, but we had this discussion that, again, you folks will let us know if it's happening too, even if you can fix it, because again, this should not be happening any longer. So, that would really, that's a big concern, because that is taking away someone's choice. They should not be flipping unless they know they're going to a different plan.
yeah,
I
I will
also-
also just add, sorry, I wanted to just add too, like in the cases of our auto enrollment, because our commercial plans are only Blue Cross and neighborhood,
right.
that is a case where someone might be getting flipped, so to speak, but they should be aware of that
Yes.
change, because again, we will be sending them email communications. Now, if this is somebody who is like not at all auto enrolled, they were not informed of that, or again, they might have been flipped from a different plan to something else, then again, that might be a larger issue. But
Right.
I just wanted to add that in case you get someone who has that concern, but technically maybe they have been automatically enrolled through HSRI into that neighborhood plan.
Right. Thank
I
you.
just want to assure people it's nothing nefarious. You know what I mean?
Right. Yes.
That it's
Yes,
something that
absolutely.
that
And
can be easily corrected.
we will fix it. If they were changed erroneously, they do not have to stay in the plan they did not choose. And again, just since we're on this topic really quickly, at this moment, until we have, as folks know, I think from previous discussions, but if, because we didn't do an actual open enrollment for Medicaid, which is called MAPCO, as you all know, Medicaid Annual Plan Change Opportunity. We didn't do that specifically this year because of RTNO. So what we did instead is we are allowing people to change without cause. So generally, once you're on, you have 90 days to change a plan. If you stay on beyond that 90 days, then you can only change plans if you had good cause, or you have to wait for that annual renewal. In this year until the fall, when we do our MAPCO again, people have an opportunity to change plans just because they want to, as long as it's with once in a 6-month period. It can't be more than once in a 6-month period. So I know that's a little bit tangential to our conversation, but I just wanted you to get a sense of that. That's still happening now until, again, we do our renewal. Fortunately, our plans are really good, and I think a shout out to them because many people want to remain where they are. We have very few folks requesting changes because the plans do a really good job of trying to work with the member around their issues. So.
Thank you, Lisa. Thank you for all the wonderful questions and comments. We heard that giving people time has made a difference. We heard that making sure that people stayed informed has made a difference, and bringing and having spaces for all your comments has truly made a difference. So thank you again for your partnership. This is the last advocate forum that we're going to have for the season. Stay tuned if you know, we decide to have another one, and or if there's information that we know that you need to know, we will share that with you. We'll let you know when we have another one if it's necessary. But thank you so much. It's been wonderful to see you all every month, and I look forward to seeing you all in the community. Have a wonderful day.
Yes, thanks, folks. Take care.
Thank you.
Thank you.
Bye-bye.
Bye.